Can you believe Medicare is finally making huge changes for Part D for 2024 and 2025?
It only took the government 18 years and the pandemic to wake them up.
In today's video, we'll highlight 5 major changes that are in your favor. Hi, I'm Ann.
And I'm Kai. The first major enhancement for 2024 is that you will no longer have to pay a penny in Phase 4, called the catastrophic level. Now, if you're not familiar with the 4 different phases for Part D, we'll show you a video later where we discuss that in full detail.
For those of you already on Part D plan, you know that you still had to pay up to 5% of the drug costs in Phase 4, and there was no max out-of-pocket to protect you.
Ready for more good news?
In 2025, there will be a $2,000 out-of-pocket cap for Part D prescription drugs and the option for those with Medicare Part D coverage to pay out-of-pocket costs in monthly amounts and to spread them out over the year.
That's just so awesome. So many of our clients will benefit from these huge savings every year.
Oh yeah, for sure.
The next major enhancement has to do with insulin. Now, in 2024, the Part D plans must waive the deductible, that $545 deductible, to any Part D covered insulin product and must charge no more than $35 per month for a supply of each covered insulin.
So a flat $35 across all 3 phases? Wow, that's pretty awesome.
That is awesome.
Now, in 2023, Medicare Part D started to cover vaccines such as shingles, tetanus, diphtheria, and pertussis vaccines. But there were typically a deductible and copays associated with those vaccines. But in 2024, Part D plans must waive the deductible and cannot charge you any copays for those vaccines.
Now, keep in mind that the flu, pneumonia, hepatitis B, and COVID-19 vaccines will still be covered under your Part B of Medicare, not Part D.
Right. Now, before we discuss the last 2 changes, many of you know our channel is not just on Medicare. Our goal is to help you stay up to date with Medicare, Social Security, and other income-related topics so you can retire healthy and wealthy. There will be more changes in 2024, so make sure you subscribe so you don't miss out.
Now, the next change for 2024 is lower Part D premiums. The average total Part D premium is projected to decrease in 2024. There are 2 primary reasons for this one. One is premium stabilization. Now, prior to 2024, Part D plans have raised their rates as much as 200 to 300%. Like almost there's no control over that. Well, in 2024, there are new laws in place called premium stabilization. So in 2024, the annual increase in the base premium is now capped to not exceed 6% per year.
Second, there will also be a Part D pharmacy price concession policy for 2024. In the past, Part D plans in the pharmacy would be able to negotiate these prices, but you, the consumer, didn't always get to benefit from those savings. Well, this policy finalized by CMS will apply across all phases of the Part D benefit and is expected to reduce your out-of-pocket costs and improve price transparency and market competition in the Part D program.
That's, again, another awesome change. Next are for those who qualify for LIS, which stands for Low Income Subsidy, also called the Extra Help Program. These subsidies provide help to pay for your monthly premiums and co-payments. This program will be expanded in 2024.
So how do you qualify? Well, we're going to look at your income and your assets. In 2023, you must be under 135% of the federal poverty level. But in 2024, that will be expanded to 150% of the poverty level. We'll leave a link for details on what assets count towards this Medicare savings program.
Now, there are 2 ways to enroll in a Part D drug plan. One is with a standalone Part D plan, typically paired with a Medigap, also called a Medicare supplement plan.
And the other type is with a Medicare Advantage plan that already includes the Part D drug plan.
Now, have you ever heard you should never buy a Medicare Advantage plan, even if it comes with a drug plan included? Well, if so, watch this video here where we battle back and forth between our mothers and who made a better decision. See, my mom bought a Medicare Advantage plan that included a drug plan.
But my mom chose a Medicare supplement Medigap plan.
Well, whose mom made a better decision?
Oh, my mom, of course.
What?